Another common practical question which we face from patients is, sir, I have only Indian toilet at home. Can I use it? I have undergone a hernia surgery. Is it safe to use an Indian toilet? The answer to this is yes. Squatting does not increase the chance of a hernia surgery failure. Indian toilet can be safely used by patients who have undergone hernia operation. Especially if the patient has undergone laparoscopic hernia repair, they are free to use both Indian and Western toilets. If the patient has undergone an open operation and for a very large hernia and the patient is overweight, during the initial phase of recovery, using an Indian toilet might be slightly difficult because of their inability to squat and to be able to get up from that position. So for the initial time, because of the pain factor, we advise them to use a Western toilet or get a custom made stool for passing motions. But once the pain decreases, and usually after 6 weeks of time, all patients who have undergone hernia operation can use Indian or Western toilet without any fear of developing any complications. But one thing which patients have to remember is they should not be straining at stools. So this is one advice we give to all patients. You must make sure that your fluid intake, fiber intake is adequate, and despite this, if patients have any problem of constipation, they should use a stool softener, which we generally recommend, for a period of 6 to 8 weeks, so that during the healing time they do not strain too much at stools. The type of toilet generally is not a major concern, but having constipation and regular straining at stools might be harmful for a successful healing of a hernia.